This is Jeff Strickland, NMOT 136, Introduction to Clinical Skills. I'm performing procedure 30-2 using chemical cold sterilization for endoscopes. Instead of endoscopes, I don't have one. I'm substituting the instruments that we used for assisting in surgery. Those have been sanitized in accordance with procedure 21-7, sanitation of instruments. They have been laid out and they have completed drying. And put on gloves, okay, which I have gloves on. So we're going to mix the chemical that is going to go into the container. And I have a germicide that kills HIV, hepatitis B, hepatitis C, and a whole bunch of other stuff. But I only have one packet, so I'm just going to simulate that. We've mixed that 61-ounce packet, mixed that with 1 liter of water. And move this to pour it, move it closer to the edge. I'm going to take the instruments using a sterile forceps and drop each one into the solution. Oops. Needle holder and the scalpel handle. Going to close the container lid. And then we'll label it. Today's the 26th. So the germicide date. The time required to keep the instruments in the cold sterilization process. Most offices have a package of instruments they use for procedures. We're going to call this package A. In this case, package A would include the instruments necessary to do excision of a mole, so we're going to assume that the time has passed and we're going to open the container. We're going to put on sterile gloves in accordance with procedure 30-1. And I'm going to use distilled water for rinsing, but we're going to pick up an instrument and then rinse it with copious amounts of water. I'm not going to use a whole lot here, don't waste my water. And then we'll hold that to let it dry. Or dry enough. Then we'll place that on a sterile towel, and you can't see my towel. Move that in there. I think that's in the field now, yep. And we'll lay that on the sterile towel to dry. And again, we apply it. I'll just show that we're doing it. As we do this, we rinse them with water before we drop them. And that's that.